Hey everybody, how are you doing today? I hope you're doing fabulous. By the way, my name is Eva Francis. I have been getting a lot of questions about how to launch a healthcare staffing business. I'm the owner of Brilliant Healthcare Recruitment and Staffing, and I'm also a consultant in the healthcare staffing space. I have created or I've built from scratch a multi-million dollar healthcare staffing business. And I want to continue in that vein to teach more healthcare professionals how to launch, how to scale, how to lead a healthcare staffing business. Because it is it's a powerful market out there. It is a business that if you structure it correctly, you'll be successful. And I have had so many colleagues who have actually gone into the healthcare staffing space and are not successful. And why? Because it is not a quick fix. It is not a quick fix. What you need to do is you have to ensure that you understand that when you enter the healthcare staffing space, you are entering the space to serve. That's the first thing you have to tell yourself. You are entering to serve healthcare professionals. You're gonna provide nurses, allied health workers to organizations who need your support, who need the help. That's basically what it is. You are going to recruit the best talents, the best possible talents, promote them, and supply the organizations with these talents. You are the chief nursing officer for your company. You are the chief executive officer for your company. So just like you report to a CNO in the hospitals, in the same way your nurses will be reporting to you, and you are going to ensure that you build the best company. You are going to ensure that you send or you assign the best, the most qualified nurses in the organization. Many new agency business does not survive. Why? Because many times you assign unqualified staff to take care of patients. And when I say unqualified, I mean specialty wise, because a nurse is a nurse. If the nurse graduate from nursing school and have the experience, yes, they can work in a hospital, but that doesn't mean they can work everywhere. What I mean by that, an ICU nurse is not a med surg nurse. Not necessarily. The med surg is a specialty, but a lot of people don't understand. Med surg is a specialty by itself. ICU is a specialty. ER is a specialty. So if you have ICU nurses, don't assign them into the ER just because they need ER nurses. You must ensure that ICU nurse has the competency to work in the emergency department. The ICU nurse don't have to be able to work in the telemetry area. Some ICU nurses cannot work tele because telemetry is a specialty. Cath lab is a specialty. Med surg is a specialty. And see what happened is that we tend to want to assign a nurse is a nurse and we assign them everywhere. So you have to ensure that you build, you carve out, you cultivate your organization so that hospitals and long-term care facilities know that they are getting the best. They need you. They need staffing. And when you assign those great nurses to the organization, they feel so comfortable knowing that you are taking them into consideration and you understand the business of staffing. So you have to make sure you know what you're doing before you go into the staffing industry. So I'm saying this to you to let you know that I am going to be training not only nurses, entrepreneurs, how to build, start, scale, lead a healthcare staffing agency. I have a program coming up in January. It's going to be starting on January the 11th for 5 weeks, 2 hours per week for 5 weeks. And I'm going to teach you all the ins and outs of building a healthcare staffing agency. I'm going to teach you understand sales, how to recruit healthcare professionals, and how to set up your business, how to get legal, how to ensure that you have your licensure, how to ensure that you understand the funding and you understand the software, you understand all the ins and outs, how to get contracts, how to get agreements, how to sit in front of a decision maker, how to get your contract and how to build your staffing agency, how to make money and how to serve. That's it. How to make money and how to serve. I'm going to go through from A to Z how to build a staffing agency. So this course is going to be starting January the 11th, February the 8th. And I'm going to be placing all the information that you need to know in the bio below this YouTube so you can know that we are ready to help you. We're ready to serve. This is not a joke. If you are not serious about serving and making money, don't sign up because we are going to work you. We're going to ensure that you have what it takes. You have the consistency, you have the strength, you will have the motivation, you have the mindset to be an employer, not an employee. And you can build that company and eventually start making some money. All right. So that's what it's going to be, how to build your healthcare staffing agency. That's a course that's coming up. And I know that you are going to enjoy it. So click the link below, sign up, because this is something that you need to be a part of. Take care. Bye now.